Thank you, sir.
Yeah, Dr. Malami is
Good
here.
evening, everyone.
Good evening, sir. You're highly welcome, sir.
I'm sharing my screen. Can you see it?
I'm not yet, sir.
Okay.
Yes. Good evening, sir. Good evening, everyone. You are welcome to another session of 2025 Research Methodology workshop of ARD UDUTH. Today, we are taking the second part of the week 1 lectures, which is how to develop a proposal. Thank you so much for joining, and thank you for your patience. You are highly welcome, sir.
Yes. Thank you very much, Dr. Mujtaba. I don't know whether you are still, you cannot see my screen or you can see it.
We can see UDUTH logo only.
Okay.
Yes.
But not the content of the screen.
Yes, we can only see logo.
Okay.
Maybe you stop sharing and reshare.
Okay. What of now? Can you see it now?
Yes, sir. Not yet.
Okay. Okay, go to the last part. Ah, come back, come back. Yes. So I think you can open the class so that we start.
Okay, good evening, everyone. You are welcome to the 2025 Research Methodology Workshop. This is day 2 of week 1. We're starting with how to write a research proposal. We welcome our teacher, Dr. Malami Muhammad Bello. Thank you so much, sir, for gracing this occasion. We so much appreciate. You're highly welcome, sir.
Thank you very much. And I want to apologize for all the delays that were encountered. Please, it was due to some issues beyond my control here. So today we are going to look at how to write a research proposal. Continue. Next slide. Yes. Before we go into that, let's look at what is research proposal itself. So simply, research proposal is a document that is written by a researcher that provides a detailed description of the proposed study. So in your research proposal, you are going to write a detailed explanation of everything you do in your research, from the title up to the analysis level. So in proposal, everything that you are going to do, you have to write it. Even who is going to take data for you, who is going to do this, who is going to do that, you must write everything from the title up to the analysis stage. So I think this part is also very, very important for us as a resident. So next slide. What are the techniques of preparing research proposal? So if you are preparing a research proposal, you have to use some techniques. Some of these techniques include: 1, a good place to begin preparing a research proposal is to ask yourself a series of questions. What do I want to study and why? So before you even come up with a research proposal or with a title of the study, you have to first start asking, or start thinking, so that you come up with something that is very good, with a title that can be that has a problem that need to be solved, because any research is attempted at solving a particular problem. So now, for you to have to write a research proposal, you must start by asking yourself, what do I want to study? Maybe you can do that by observation, by searching literatures, by asking questions and doing other things, so that you ask yourself, what I want to study. Because if you don't know what you want to study, nothing will come up on it. And everything that you think you want to study, you must have interest, and you must make sure that this topic can be researchable. This topic is researchable and can be solved within the particular time before going for exam. Then why did I want to study this area? You have to also answer that. Then how is this significant within the subject area covered in my desire? What problem will it help solve? We have all discussed this. So when you are thinking of a particular study, a particular area that you want to research on, you have to ask all these questions and answer them before you now go into the proper proposal writing. Then what exactly should I plan to do? And can I get it done in the time available? You cannot present a study that maybe cannot be finished within the period that you want to go for your exam. For example, you cannot bring a cohort study for part 2, because cohort study may take many years before its completion. So anything that you want to do, you have to wait, think, and ask yourself and answer the questions. What did I want to study? Can I have enough participants for this study that I want to do? Can I have enough literature for my discussion and my literature review? You cannot just bring a study that nobody has done before. Even if you do it, you will suffer. You will suffer more than you think. If you are bringing a research that no one has done before, then you will suffer, and you will not have enough to do with it, because you will not have enough literature review. You will not have enough discussion. You don't have the data to use for discussion. You don't have the data to use for literature review and for your comparison. So you must make sure that any topic that you are taking, you are bringing a topic that you can have enough literature for it. Then when you ask this topic, questions, the next thing is, let's look at the components. We are going to look at the component of a research proposal. The components of a research proposal include title, abstract, introduction, literature review, methodology, work plan, budget, detail of research team, then references and appendices. So these are the components of a research proposal. So we are going to look at them one after the other. Title. So choosing your dissertation topic is the first step. It is the first step in making sure your research goes as smooth as possible. Think of the title early. Revise as you go along. A good title should be specific, direct, concise, meaningful, and easily understandable. That is, you must be specific. And that a title must contain the study population, the area, the area, or the community, the name of the community, or the name of the area that you want to study. If you want to study in UDUTH, you have to specify the area that is in UDUTH. If you are studying in SOKOTO community or in SOKOTO metropolis, you have to specify that SOKOTO metropolis. The study population must be there. So, for example, you can say knowledge of malaria treatment among healthcare workers practicing in Sokoto metropolis. So you have to have the name of the study population, the name of the community or the area where you want to study, and also the title, the main aspect or the main aim of your study. So they have to be in the, so that is why it has to be specific. The title must be specific and it must be direct. Anybody that look at it can picture what you want to do. Then it should be concise. You should not have a title that needs more clearance. So once you have a title that is very good, that is very concise, anybody that sees that title will understand where you want to go. Then the title should not have too many words. So it should have at least less than 20 words. When you are bringing title with many words, then it is no more a good title. So a good title should have less than 20 words in it. Then it must accurately represent the objective and indicate the purpose of the study. Yes, you have to indicate the purpose of the study, and also the objective of the study must be in the title. It should help the reader understand the nature of the work. It should have the most important words mentioned at the beginning of the title. For example, if you want to study knowledge, attitude, and practice, so the most important among them should come first. If you think knowledge is the most important, then you start with the knowledge, then attitude, then practice. Then if you think practice is the most important, you can say practice, knowledge, and attitude. So that is how a good title should be written. If you have different words, then use the most important words first before the subsequent ones. Avoid ambiguous words. You should avoid all ambiguous words that you think they are not necessary. All words that are not necessary, avoid them in your title. Next. Yeah. When choosing a topic, it is important to consider this. One, your institution and department's requirements. This is also important. It is important because some institutions have their specification. Some departments and faculties have their own specification. So you have to also consult your departmental specification to see the specification they need for you to come up with the title that you want to study. Then your area of knowledge and interest. Your title should be in the area in your area where you have interest. For example, you are in internal medicine and you think you want to specialize in cardiology. So you should have your own topic under cardiology. Don't go somewhere, because any area that you do your part 2 is most likely your area, because you have to go deep in that area before the end of that research. So it is very advisable to go into the area that you want to specialize before you come up with the title. Then the specific social or practical relevance. So your title should have a scientific relevance. It should not just bring a title anyhow. It should have a scientific relevance, because all the colleges look at this title, whether it has relevance in scientific applications. Then practical relevance also. It should also have a practical relevance. You cannot just come and bring any title anyhow. Then the availability of data and resources. That's what I said before. You must make sure that you have enough data. You have enough respondents. If you think what you want to study is very difficult for you to get a respondent, to get research research participant in that, I'm advising you to drop that research because it will suffer you. It will be very difficult for you to finish. Because whenever you want to, maybe you have calculated sample size of 50 or 100, but it is very difficult for you to get 30. How are you going to go? Where are you going to go and get them? So you have to make sure that the area that you want to bring, you can have enough participants in that. Then you can have also enough data and resources. For example, some people think of a research that they cannot fund. They don't have resources to conduct such researches. Maybe the research require one investigation that you cannot even afford. So how can you conduct that research? Because you cannot afford it. You have to bring something that you can afford. If you bring something that you cannot afford, and once they approve it, that is all. You are on your own. You have to go anyhow to get the fund to conduct the research. So before anything, you have to make sure that your topic is affordable for you. It's affordable to you. You have resources for it. You can get your data easily. You have enough literature to back it. So that is the most important. You should not come up with research without this, considering all these things. Next is relevance of your topic or time frame of your dissertation. You should also look at the time frame. Some researches take a long time, while others can be conducted within a very short period of time. So you have to consider that time frame to make sure that your research can be conducted within the time frame that you want to finish. Next. So after title, the next thing is what? Is summary or abstract. Abstract is the summary of what you want to do. It's the summary of everything, all your research, from the introduction, literature review, the methodology, and the analysis. So this is the abstract. Your abstract should be very concise, and it should include the background of the study, the aim of the study, the methodology. At least you summarize the methodology in a concise manner, so that you should not have more than 300 words in it. Most of the abstracts should not be more than 300, but in some cases, some are saying 250 and some are saying 350. But within that, from 200 to 350 words, depending on the faculty or colleges. So that is abstract. Then introduction, which is chapter 1. So you start with title. Next is abstract. You must have abstract or summary. Then next one is chapter 1. Chapter 1 is the introductory chapter. So this chapter 1 has some steps. These are the steps in writing chapter 1. Number 1, background information. It should have a background information. This background information is just an information to bring about the background of your study. The background, just this is maybe the main chapter or the main topic of your research. This is where you introduce it. You introduce everything about the research. Then problem statement. So you can write it like this: 1.1 background information, 1.2 problem statement, 1.3 justification of the study, 1.4 scope of the study, 1.5 research questions, 1.6 aim and objectives, then research hypothesis. So let's go briefly into this outline of chapter 1. So background begin by brief introduction of your general area of interest. It is important to contextualize your research and generate interest, because it is from your background where some people, some readers will have interest in the research. If your introduction, your background is somehow written, you have not conceptualized it very well. Once they read it, they start reading it from the background, they will lose interest in it. But even if it is very simple research, if it is very easy to conduct, once it has a very good background, as readers reading it, they will be interested. They will be interested on it. And they are reading it, they are beginning to be interested in it. So they will now have an interest in it, and you will they will be encouraged on that. So that is why you must have a very good background to conceptualize everything that makes it very suitable and very interested. So the aim to show why your topic is timely or important, you have to put it, the aim of the study it should be in the background also. Maybe after your introduction, you may say, this study aims to do and that. So that is the end of the background before you now come to the problem statement. So now when you introduce the topic in the background, the last paragraph should be the aim. Maybe this study aims to find this, and that. That is background information. Then problem statement. This is done to describe the situation that led to the proposal research, to the proposed research. So some of us are writing problem statement that is not a problem, something that is not the problem in that research. If you are writing a problem statement, you have to look at, why are you doing this research? What is the problem that I have observed to prompt me into this research topic? So that is the problem you will bring, not maybe the prevalence of the disease, of that disease you are studying, this, and that. No. For example, if you are looking at, maybe you want to research on knowledge of healthcare workers, knowledge of malaria among healthcare workers. So here your problem is not malaria. Yes, your problem is knowledge. Are they having poor knowledge or good knowledge? Their poor knowledge, what will their poor knowledge lead to? So if the healthcare workers have poor knowledge on malaria, they will be prescribing incorrect result, no adequate diagnosis. No, that is the problem you are bringing, not the problem of malaria itself. The problem of your research, maybe you are thinking they have poor knowledge of malaria. So because of that, they cannot even educate their patient, and the patient will not have will not have the correct drugs being prescribed to them. That may lead to maybe poor sensitivity of the this, and that's the problem. So your problem here is not malaria. Some people, if they are writing problem statement, they will just go to be writing the problem of the disease, not the problem they are looking for. So that is problem statement. Next. Next is justification. So justification of the study also, we are making many mistakes in writing our justification. So justification is to show why this study needs to be done in this area or in this environment. You can say maybe if the problem is there, has been there in the area, but it has not been addressed by any study, that can be a justification of your study. You can also have a justification that if this research is conducted, it will generate a baseline data for policymakers to use in order to address, in order to use in the intervention programs for this problem. So you see, it's a justification. You can say this research, when conducted, it will help in doing this and that and that and that. That is justification of your study. But some people, when they are writing justification, they will just go and write the problem statement as their justification. That is not a justification. Justification is, why do you think this research should be conducted in this environment? So if a research of that kind has been done before, it means even if that is a problem, that has not been a problem now, because that problem has been solved by a research before that was conducted before in the area. That is why they are saying, if a research is conducted in a particular area, that such research should not be conducted again, because it has resolved or it has solved the problem that is there. Maybe unless you have not seen the research. What is happening? I'm not seeing this thing again. The Dr. Mujitaba. I'm no longer seeing your slides. Hello, Dr. Mujitaba.
Sorry, my network fluctuates. I'm so sorry for the inconvenience.
Okay.
Hello, sir.
Yes, Dr. Mujitaba, I can hear you, but I'm not seeing. Okay, yes. It's
Yes,
showing
sir.
now.
Yes. Sorry, sir. My network fluctuates. I think because it runs.
So let's continue.
Okay, sir.
Okay.
The justification.
Okay, justification. We said in this section, the researcher needs to justify the importance of the study. This is the importance of this study. This is why, if the study is conducted in this environment, this is what it will bring. Then the section covers the following issues. 1, relevance and importance of the study. 2, practical application of this study outcome, I have explained. Then how the new knowledge gained through the study will contribute to the solution of the practical problem. And then how the study findings will be useful in policy formulation. So that is what I have explained just now. Next slide. Next slide. Do you have another challenge, Dr. Mujaba, or I should switch to my system because it is ready now? So let me switch to my system. Please, we are sorry. Dr. Mujtaba is having a network issue, and I'm going to switch to my system so that we continue. So sorry, please.
Hello, sir. Hello, please, am I audible? Hello.
Hello, Dr. Mujtaba. We're hearing you.
Hello, sir.
Now?
Please, am I audible? Okay.
Yes.
Okay, sir.
Okay. I think I want to use my system, Dr. Mujtaba.
Hello, sir. Thank you. Hello, sir. Hello. Sir, please, can you hear me? So sorry, the network is poor today because of.
Inshallah. Okay. So we are into the justification of the study. We have discussed that. Then the next one is the important questions to. Okay. These are the important questions to respond to in writing justification. 1, is the problem currently and timely? 2, does the problem have serious consequences? Does the problem affect or potentially affect a large number of people? Does the problem relate to ongoing problem activities? Does the problem have broad social, economic, political, and health implications? If the problem viewed as a concern by many different people, have study already addressed the problem? So you have to look all this problem so that you justify your study. Because the justification is also one of the most important thing that examiners look before they approve a topic. Is it justified to do it or not? If you can justify it, then you will be allowed to do it. But if you cannot justify doing it, then you will not be allowed to do it. So next thing is the scope of the study. After a brief introduction to your general area of interest, narrow your focus and define the scope of your research. You can narrow this down in many ways, such as geographical area, time period, demographics or communities, themes or aspect of the topic. So now if you come up with the topic, you cannot conduct everything in your research. You cannot cover everything in that topic in your research. So the scope of your study is the area, only the area that you want to cover in your research. That is what you will bring as the scope of your study. So you only want to know, you only want to study in the so area. The time period you specify. You demographics you specify. That is, you make a specific explanation of where you want to study. That is the scope of the study. Because since the topic is broad, you cannot do anything. You cannot conduct everything to cover everything for that topic. So you have to now narrow your scope to show the reader that this is where I want to study specifically in this area. So that is the scope. Then research questions. A question well stated is a question half answered. Yes, this is a statement. Very good statement. If you have stated your research question very well, then you have answered it by half. But if the question is not being stated well, then it is very difficult to be answered. So now, for example, let's say I want to study the knowledge of malaria, malaria among primary healthcare workers. In that case, my research questions will be, what is the knowledge of malaria among healthcare workers? So in this one, after the research, your conclusion should supposed to answer this question. So maybe at the end of the research, you find out the healthcare workers have a poor knowledge of malaria. So you see, in your research question, you already said, what is the question? What is the level of knowledge? And at the end of your study, you are able to say their level of knowledge is poor. So you have already answered your question. So any research question should be stated in such a way that it must be answered by the research after the research is finished. But you can see some people are asking questions that even at the end of their research, they cannot answer such questions. So such are not research questions. Research questions should answer what your research is supposed to answer. So a proposal should contain explicit statement of research questions. Then research question must be formally stated with clarity, specificity, appropriate inclusiveness, feasibility, and then importance and relevance. You postulate what are the possible expected outcomes of the study in your research question. Determine if the information needed for the study are realistically assessed. Then the usefulness of the expected outcomes. So here, in summary, once you have aim and objective, once you have your research objectives, so your research objective should be formulated, should be reshuffled, or should be you should just change your research objective to become research questions. For example, if your first objective is to assess the knowledge of primary healthcare workers regarding malaria, so the research question of that objective should be, what is the knowledge of primary healthcare workers regarding malaria? If your research objective is to identify the factors associated with practice of infection prevention and control among primary healthcare workers, then the research question should be, what is the level of practice of IPC, infection prevention and control, among the primary healthcare workers? So you see, your research question and your research objective should come one-on-one. If you have 3 objectives, you must have 3 questions. And the objective, they are the ones that are set in form of questions. You just reset them in form of question. So if you have 3 objectives, you will have 3 research questions. If you have 4 research questions, you must have 4 specific objectives. That is it. So this is the next thing is research objective, or aim and objectives. So the aim is usually the title, the title of the topic is usually the aim. So your aim is to find out, maybe if my research title is factors associated with infection prevention and control practices among primary healthcare workers in Sokoto metropolis. So this is my research title. So my aim will be to identify or to determine the factors associated with infection prevention and control practices among primary healthcare workers. Then after the aim, you will have specific objectives. So the specific objectives, it is the M that you will now remove the objectives from the M. For example, the main M is the practice, to identify the practice of IPC, TB IPC among primary healthcare workers. So in my specific objectives, I can say, what is the knowledge of primary healthcare workers on IPC? Do they even know what is IPC first? What are the factors associated with this IPC? So you see, what are the predictors of IPC? So you see, is 1M has 3 specific objectives. So that is how you will now be writing your specific objective M and specific objectives. So the formulation of objective will help you to focus the study and narrow it down to essentials. You should avoid the collection of data which are not strictly necessary for understanding and solving the problems you have identified. Because some people, they say they want to do this, but when they are collecting data, they collect data beyond what they say they want to do. I said my objective is to find the to find the practice. But now you are collecting data that is not even part of your specific objectives. So that is irrelevant. That is not relevant. So your specific objective is helping you to avoid the collection of data which are not strictly necessary. It will also help you in organizing the study in a clearly defined parts, because everything are done based on specific objectives. So your literature review should follow specific objectives. Your research questions follow specific objectives. Your research objective follows specific objectives. Your analysis plan must also follow specific objectives. Your conclusion will follow specific objectives. Your recommendation must follow specific objectives. So these objectives, they are very, very important in research. You must know them in and out, because everything that you do, you are going to organize it according to specific objectives. So that is even your result in organizing results, you have to organize your result according to specific objectives. The next thing is, okay, objectives are first stated in general terms. That is the general objective or the aim of the study, then followed by specific objective. We have explained this thing. Then research hypothesis. Research hypothesis is an assumption. Hypothesis is an assumption regarding the value or relationship of variables that need to be tested. It can also be defined as a statement about an expected relationship between one or more independent variable and one dependent variable. It is expressed in the form of a statement and not a question. It is consistent with the research question. You have seen that. So now, in the research hypothesis, not all objectives have research hypothesis. There is the objective that must have research hypothesis is the objective that needs statistical test to be assessed. For example, if your objective is just a description, you just describe, you find out and present it in either percentage or frequency, that one doesn't require any hypothesis. Because hypotheses are assertions. They are assertions that you think something is the cause of something. So you want to find out, you want to now make an assertion that this is the cause of this. So you now use a statistical test to find out, to test that hypothesis. So if an objective doesn't require any any association, any relationship, then there is no need for a research hypothesis. For example, if you want to find the prevalence, you see the prevalence is just to state the frequency and the percentage. It doesn't need to be to find out whether something is causing something. No, it's just to present it in terms of percentage or proportion. So that one doesn't require any hypothesis. Or you want to present the pattern of something. So any pattern doesn't require any hypothesis. The objective that require hypothesis is the objective that is that want to find an association between one variable to the other, association between one group and other, relationship between one variable to another, the predictors of something, risk factors of something. So they are the ones that require hypothesis. Then the prediction is tested by forming a null hypothesis. So now, if you want to state a hypothesis, each hypothesis should have two independent hypotheses. That is, null hypothesis and alternate hypothesis. So now, if you have two objectives that require hypothesis, you look at all of them. For example, in our last example that we say we want to know the factors associated with tuberculosis infection prevention and control practice. So now our first objective is what is the knowledge of, or to assess the knowledge of healthcare workers regarding tuberculosis IPC. So you see, this one is just assessment. Assessment doesn't require any hypothesis. Once you say you want to assess this, that assessment doesn't require hypothesis. Then we leave it. The next objective to identify the factors that are associated with IPC practice. So this one requires a hypothesis. Because why? Because it wants to identify the factors associated with something. This associated with this, or this associated with that. So this one requires a hypothesis. So how do you state hypothesis? Now you have to follow your objectives one by one. Anyone that requires hypothesis, you state it. You now go to the next one, state it. So in the statement, you have to state two for each one. For this objective that we say to identify factors associated with TB IPC among primary healthcare workers, that this one should have two hypotheses. One null hypothesis and the other one alternate hypothesis. So the null hypothesis is the hypothesis to be tested. Always null hypothesis is the first one because it is the one to be tested. If you test it and you find it not true, then you now adopt the alternate hypothesis. So alternate hypothesis is usually the opposite, direct opposite of the null hypothesis. So null hypothesis is the hypothesis of no difference. So therefore, in the statement of null hypothesis, if you want to state the null hypothesis for this, our objective, how do you state it? You can say socio-demographic factors are not associated with knowledge or with the practice of tuberculosis infection prevention and control practice. So you see, you have to say because it is hypothesis of no difference. Maybe if you want to also state hypothesis, maybe that you want to find a relationship between this and this, you can say there is no significant relationship between this and that. If you want to find the difference, you can say there is no significant difference between this and that. So that is null hypothesis. It's also saying there is no. It is also saying there is no. there is no significant association between this and this. There is no significant difference between this and this. Or this thing is not significantly associated with that. Or this is not significantly related with this. So that is how you state your null hypothesis. So when you finish with the null hypothesis, the next one is the statement of alternate hypothesis. And we say the alternate hypothesis is the direct opposite of the null hypothesis. So if your null hypothesis say there is no significant difference between this and this, your alternate hypothesis will say there is a significant difference between this and this. If the null hypothesis say there is no significant association between this and this, so your alternate hypothesis will say there is significant association between this and this. So that is how you state. So if in your objective, you say our objective is to find the relationship between medication adherence and family help or family encouragement of something. Maybe your family are encouraging you. So if you want to find the effect of family encouragement on the medication adherence, so you can say medication adherence or family encouragement is not significantly related with medication adherence. That is your null hypothesis. Then alternate hypothesis, family encouragement is significantly related with medication adherence. Or family encouragement is significantly associated with medication adherence. So this is the null hypothesis and alternate hypothesis. So if you have 3 objectives that each one require hypothesis, you have to state all the hypotheses. So you finish with the second objective. We say first objective doesn't require hypothesis, we leave it. Second objective requires hypothesis, we state it. We state the null and alternate hypothesis for it. Then you go to the third objective. Does the third objective require a null hypothesis? Yes, maybe we say we want to find the predictors. So the predictors, it means you also need to state the null hypothesis. So you can now say maybe age is not a predictor of practice, of IPC practice among healthcare workers. Then alternate hypothesis, age is significantly related or is a predictor, is a significant predictor of IPC practice among healthcare workers. So this is hypothesis, null and alternate hypothesis. So usually a hypothesis, when you state hypothesis, so any hypothesis that you state, you must also know the type of test that you are going to use in order to test that hypothesis. So at the end of the day, the statistical test that you have used in testing that hypothesis will now show you whether to reject the null hypothesis or to adapt it. So if you now, at the end of your statistical test, you can now see whether you will reject the null hypothesis and therefore you go for alternate hypothesis. And if your statistical say you should fail to reject the null hypothesis, it means you have to adopt the null hypothesis. Then you adopt the null hypothesis and conclude that there is no difference. But if your test say you should reject the null hypothesis, then you reject it and conclude with there is a difference. So that is alternate and null hypothesis. The next thing is literature review. This is the chapter 2. Literature review is done to find out the past research conducted on the subject. What are the past researches that have been conducted in this area? What are the results? What are the results they have gotten before? So that I will know what is the gap in the previous objective, so that my own study will address such gaps. So in literature review, it will help you to identify what was done in the past and the knowledge gap on a particular subject. You will use it to find out the gap that they were not addressed before, and then the ones that had been addressed. Then you now combine it and review the literature. So many of us are making mistake in writing literature review. Let me show you, let me tell you the best way of writing literature review. The first thing you do, you have to cite. Okay, no, this one, let me continue. And yeah, you have to cite. How to cite? Or before you even start citing and doing the literature review, you have to look at the steps. Okay. Yeah. The mistake that we are making in literature review is that we usually do overview, not literature review. Most of our studies are done in literature review are only overview, but not literature review. Literature review, you are reviewing these your objectives that you have said you want to do, you want to research on. You are viewing the results in their results in previous researches, so that you will be able to, or you can be able to compare with your own and see the gap that your research will fill in. But most of our literature reviews are only overview. If you are conducting research on hypertension, you only do your literature review under hypertension. What are the definition of hypertension, causes of hypertension, types of tests used in hypertension, investigation, treatment, this, and that. That is how many of us do their literature review. But this is a mistake. This is a mistake. The best way of doing literature review is, one, you have to follow it according to your objectives. You can start with the overview, general overview of the study matter. Maybe you can say 2.1. So 2.1 is general overview. You just look at the general overview of hypertension. That's all. Then 2.2, that is where your literature review will start. So you now bring your first objective as heading, first heading of that 2.2. If your objective is to identify, to find the knowledge of tuberculosis among primary healthcare workers. So now your 2.2 will be knowledge of tuberculosis among primary healthcare workers. So under it, what are you going to write under it? You are going to write all the results of previous researches regarding the knowledge of tuberculosis among primary healthcare workers. You can say a study that was conducted in England or in Lagos have found out that the primary healthcare workers had poor knowledge concerning tuberculosis because of this, and that. So you see, you have reviewed that literature. You now say they used a cross-sectional study. When you cite it, you will cite it. You now compare. You contrast. This is what they have done. Maybe what they have done is not right. They're supposed to do this. They're supposed to do that. That is why they are getting a very high proportion of poor knowledge or of good knowledge. So that is, you are contrasting. You are comparing. You are citing. So when you finish with that one, you now review another one. You take another article on knowledge, still on the knowledge of knowledge of tuberculosis among primary healthcare workers. When you finish with it, you contrast it, you bring all the gaps in it, you bring everything, you now take another one until you exhaust all those literature that are talking of knowledge of primary healthcare workers on tuberculosis. When you finish that, then you go to your next objective. So your next heading will be your objective 2. So your objective 2 say to identify the factors associated with practice of IPC. So you now say 2.3 factors associated with IPC practice. So you are now bringing all the literature that talk about factors associated, what have they gotten. Maybe this study identified, find out the educational status. But another study in Lagos found the factors to be training, having attendance in training, previous training, and other and maybe other factors. So you see, you have to review all of them, all the ones that are available in your disposal. So when you finish with that, you now go to the next objective. That is how you do your literature review. So you review everything, you review all the available literature on that specific objective before you move to another specific objective. So in citing, you have to keep the primary focus on the literature pertinent to your research problem. You have to be, everything you do, you have to cite. Cite, this is what somebody says. You have to compare the vigorous arguments, theories, methodologies. What is the methodology he used? He used cross-sectional study in this. This is why he's getting this. He used the primary, the healthcare workers that he used were from the urban cities, urban area, not in urban area. So you are comparing, you are reviewing it so that at the end of the day, when you finish your own, you will be able to compare with these studies that you have already reviewed to see what is the difference between your own and their own. Are they similar, or do they have differences? So that is the importance of literature. You cannot do literature review by just showing an overview of your topic. That one is totally not a literature review. Then you have to critique the literature. You are not just stating. You are not just saying, this one find this one find it, this one find that. You have to critique it. Have they used the right methodology? Have they used the right study design, the right, everything you have to critique, whether they have done it correctly or not. What is their gap? You bring out the gap in what they have done. So that is the correct literature review. So these are the steps in writing a literature review. The first step is to hunt down the relevant literature before you even start. That's why initially I said before you even agree on the title, you must do your literature search. You must have at least what I ask my resident to do, or my students, I will ask them to have at least 50 to 100 literature before they start. So if you can find at least 50 to 100 literature for your study, then you are good to go, because this can be enough for you to do all the literature review and discussion. But if you have a very few literature online, I'm advising you to change that topic, because it will make it difficult for you. In literature review, you don't have literature to review. In discussion, you don't have literature to compare your study with them. So that is, you will just be going there and here and there, and you will not have enough. And people, once the examiner see it like that, they will think you have not done anything. The part 2 work is just, you cannot come and do this for part 2 work. That's what they will say. So you must have a very good literature. You search, you hunt for the literature. You use any search engine to hunt for them. When you have enough literature, then the next thing, you need to log all the articles in your reference manager. Yes. All these articles that you have hunted, you have to now log them. You have to put them in your, if you are using EndNote, you put them in your EndNote. If you are using Mendeley for your reference, your references, you now log them into Mendeley application for your write-up. So that is the next thing. Then the next thing is, following that, you need to develop a detailed outline of your entire chapter. So this is where you now write your outline first before you even start. This is the outline I want to follow. So I told you that your outline should be as follows. 1, a brief overview of your general topic, of your general area, a brief overview of the disease. Maybe you are working on tuberculosis. So brief overview of tuberculosis. Where you now see the you now bring the definition, the causes, the risk factors, the investigations, the treatment, follow-up, whatever. It should be in that part. So that is 2.1. Then the next one is 2.2. The 2.2 is the head, your heading should be your first specific objective. Then 2.3 is your second specific objective. 2.4 is your third specific objective, like that. So when you finish with the outline, then you start the write-up. So write up your first draft in rough form. Don't aim for perfection. Remember, done beats perfect. So you should now, you can start with drafting a rough one before you now adapt it. When you start with the rough one, then you now make some corrections and adjustment and then adapt it. Then number 5, refine your second draft and get a layman's perspective on it. Then tighten it up and submit to your supervisor. So that is your chapter 2. So after chapter 2, immediately what follows is conceptual framework. Conceptual framework is also known as the research or theoretical framework. So a framework where your research goes, while it contains the scope of your research, this conceptual framework. It is a diagram of proposed causal linkages among a set of concepts believed to be related to a particular public health problem. So you must have your problem. Then what are the linkages that are linked to these problems? So this one is in their grammatical form. That is the conceptual framework. You must know the linkages that are linking to this problem that you have identified that you want to solve. How are these factors linked to this problem? And if this problem is being solved, what will be the next thing? So that is, you show all these things in their grammatic form. That is the conceptual framework. This is the example. This is example of a conceptual framework. So you see, sorry, I want to remove this. Okay, so you see the diagram. These are the socio-demographic factors. So this diagram is on knowledge and practice of tuberculosis among primary healthcare workers. So you see the linkages in the diagram. You see the linkages to the knowledge and the linkages to the TB IPC practice. And after that, what does that end up? If it ends up at the end of the day, you see last one, the TB burden among healthcare workers will either reduce or will increase. The burden of tuberculosis, if they now have good knowledge, they tend to have a good IPC practice. If this age, sex, marital status, socio-demographic factors can affect their knowledge. Training intervention, on the other hand, can affect the knowledge, can affect the practice again. Then other factors like TB training, attending TB training, that is their work experience, the organization of the health facilities, the supervision from the management, availability of PPEs and TB IPC practices can also affect both knowledge and practices. So at the end of the day, you see, knowledge can affect practice. And once practice is there, it can be either appropriate practice, it can be inappropriate practice. So those that have appropriate practice, the TB transmission among them will be reduced. You see, that is why that red arrow is going down. So the TB transmission will be reduced as a result of appropriate IPC practices among this type of healthcare workers. But on the other hand, you see those that have an inappropriate IPC practice, their TB transmission will do what? Will increase because their IPC practice is not appropriate. So it tends to increase the transmission. So at the end of the day, those with increased transmission will have increased TB burden, while those with reduced transmission will have a reduced TB burden. So this is conceptual framework of that research. So any research should have a conceptual framework immediately at the end of chapter 2. That is the next thing. At the end of the chapter 2, you have your conceptual framework. So this conceptual framework will now tell the reader or the person that is reading the proposal, these are the interconnectivity of the problem that we think we can solve at the end of the day. So you see this diagram, when you look at it, it will show you the problem of tuberculosis, the burden of tuberculosis will be reduced at the end of the day when this research is ended. It tends to reduce the burden of the tuberculosis among the healthcare workers themselves. So that is what conceptual framework does. Then next is after the conceptual framework, the next one is methodology. So methodology, that is materials and methods, which is chapter 3. Methodology depends on the research questions, hypotheses, and objectives. You see, that's why I told you that these research questions, if not, I think they are the most important thing in the research. Because anything that you do, you must do that according to your specific objectives. So generally, the following issues are covered under research methodology. 1, description of the study area. Which area are you going to conduct your research? So you can now, let's say your area is to study, your study will be conducted in UDUTH, Usman Danfodio University Teaching Hospital. So you have to describe the teaching hospital in this part. So for example, the first statement will say, the study will be conducted in Usman Danfodio Teaching Hospital, SOKOTO, which is located in Wamako local government of Sokoto State. Then you now describe the area itself, describe the UDUTH, how many beds does the hospital has, how many doctors, how many, any description, you describe it briefly. So after the description of the study area, then the next one is study design. So study design, here is the design of your study. That is, yesterday, I think we have described these epidemiological study designs. We have classified them. You can do cross-sectional study. You can do case control study, cohort study, experimental study, any other type of study, mixed method study. So all this is where you will state the design of your study. So, and here, the mistake that we are doing here, we are describing. No, you don't need to describe it. Just name this the study design you want to use. For example, this research will use a cross-sectional study design. That's all. You don't need to say hospital cross-sectional study design, which involve male and female, this and that. No, there is no need for that description. Just say you will employ a cross-sectional study design. That's all. Then you go to the next part. So your study area is 3.1, study design is 3.2, then study population is 3.3. Study population, you now mention the population you are going to conduct your research among. For example, my study population is pregnant women attending antenatal clinic in UDUTH, period. So this study will involve or will be conducted among pregnant women attending antenatal clinic in UDUTH, SOKOTO. That's all. You don't need any other thing. All other exclusion and whatever should be either in the inclusion and exclusion criteria. Then inclusion criteria. Inclusion criteria is a subset of study population. So it is not on its own. It is under study population. When you say study population, there is the pregnant women attending ANC in UDUTH, SOKOTO. Then inclusion criteria is among these pregnant women, which one among them are you including? Are you interested in? Because not all the pregnant women you are interested in. So maybe here my study, I'm interested in those that have spent 6 months in the clinic. Only those that have spent 6 months, or only those that are aged 18 to 55. So you see, I'm now including, even if you are a pregnant woman, if you have not spent 6 months in this clinic, you are not included. So you see, the general population, study population is the general, while inclusion criteria among the general population, which one are you including? So I say I'm only interested in those that have spent 6 months in the clinic and those that are aged 18 to 45. So I'm narrowing my population now in the inclusion criteria. Next is exclusion criteria. So exclusion criteria, we are making mistake also in stating our exclusion criteria. Usually, exclusion criteria is not an opposite of inclusion criteria. If you say you are including pregnant women that attend clinic that have spent 6 months in the clinic, you cannot say, well, those that have not spent 6 months were excluded. No. Since you include 6 months, it means you have already excluded those that are less than 6 months from your inclusion criteria. So no need to say you have exclude them. No. So exclusion criteria is not an opposite of inclusion criteria. Once you include someone, you cannot exclude his opposite, because the opposite has automatically been excluded by including this one. So by including those that are aged 18 to 54, we have already excluded all those that are not within that age range. automatically. So no need to say, it means you don't have exclusion criteria. If you are exclusion criteria is the opposite of inclusion criteria. You are not saying anything. Another mistake, we can say exclusion criteria, anybody that has not consented to participate in the study. No, that one is not exclusion criteria. That one, the person has already excluded himself. You are not the one that excluded them. Exclude them. So you see, it's not an exclusion criteria. So your exclusion criteria, from those that you have included, you now exclude some of them. For example, in this one, we said we include only those that have spent 6 months in the clinic and are within the age range of 18 to 54. So our exclusion criteria is 1, those with severe illness. Even if you are within, you have spent 6 months in the clinic, you are within the age range, but because you have a severe illness, we exclude you. So you see, this exclusion criteria is not even related to our inclusion criteria. So from those that we have included, how many, who are we excluding? Again, we exclude those who are HIV positive. We exclude those who have tuberculosis. So you see, they are all not related with our inclusion criteria. So this is how to state inclusion and exclusion criteria. The next one is sample size determination. Sample size determination is also according to specific objective, according to your objective and study design. Is done according to your study design and objective. So if you have a wrong study design, your sample size determination will be wrong. If you have a wrong study design, then you will have a wrong sample size calculation. So we are going to look at sample size calculation in the course of the presentation, maybe in the week 3 or somehow like that, I don't know. But we will have the lecture on sample size determination. The next one is sampling technique. Sampling technique also, after sample size determination, sampling technique is how are you going to select your sample that you have calculated. Maybe I have calculated 100 people to be involved in this research. So how will I recruit these 100 people? We are going to also discuss it later in our subsequent topics, in our subsequent discussions. Then the next thing is instrument or tool of data collection. The instrument that you are going to use to collect data. This one, many people are mistaking this one for instrument. So instrument here is not your BP apparatus, your stethoscope, your weighing scale, your this thing. No, they are not instrument of data collection. Then they are tools. They are not instruments of data collection or tools of data collection. Here, the tool of data collection is your questionnaire. If you have a questionnaire or a proforma, they are your tool of data collection or instrument of data collection. So then when you state the instrument, the type of tool that you want to use to collect your data, for example, you want to use a questionnaire, interviewer-administered questionnaire or self-administered questionnaire. So you see there is an interviewer-administered questionnaire and self-administered questionnaire. Self-administered questionnaire is the questionnaire that you send to someone and he will just answer it and send it back to you he on his own. Then interviewer-administered is the one that you interview the respondent. You ask him question and you are filling it yourself. That is the interviewer-administered. So here you will state the type of questionnaire that you are going to use. If you are going to use a proforma, you now say it. You are going to also use use the checklist, maybe checklist to look at something and check it. So anything that you want to use in data collection, you have to state it here and mention it correctly. Then validation of the instrument. How did you validate that instrument? How are you going to validate the instrument? You also need to know. You also need to mention. So validation, the content validity indexed. You have to mention whether the content, how are you going to validate the content of that questionnaire or of that instrument? So, you know, sometimes you can just develop an instrument, a questionnaire, but that questionnaire cannot even answer what you want to answer, cannot even assess what you want to assess. For example, you say you want to assess the knowledge of healthcare workers regarding tuberculosis, but you now go, your questionnaire is asking them, are you doing IPC? When you come to this, are you doing that? Are you doing that? Your question they are not even related to the knowledge of TB. So that instrument is not valid. That is why you have to state, how are you going to validate your instrument so that it will be valid. When we say an instrument is valid, it means it can assess what it's supposed to assess. You said you want to know the factors associated with this, and you have this instrument. So if the instrument is valid, it means it can assess the factors you want to assess. Then reliability of the instrument. You have to also mention the reliability. What is reliability? Reliability is the reproducibility of that instrument. For example, if you ask someone question today, the same question today, and he gives you answer, and you come tomorrow and ask him again, he gives you a different answer from that of today, it means that instrument is not reliable. It's not reliable because it has, maybe it is confusing. He didn't understand it. That is why he's giving you different answer. He's giving you a different answer today, different answer tomorrow. So that one is not reliable. So for you to know, in your literature, in your methodology, you have to now mention the reliability. How are you going to assess the reliability of this instrument for it to be valid and reliable? The next one is method of data collection. Now you have seen the first thing we say, study area, study design, study population, inclusion criteria, exclusion criteria, sample size determination, sampling technique, method, instrument of data collection. So the next thing is method. You are now develop the instrument, you are now develop your questionnaire and proforma. So how are you going to take the data now? How are you going to collect the data? That is method of data collection. You have to describe the method, the procedure, everything that you do in order to collect this data. This is where you describe it. Then the next thing is measurement of variables. So now you have described the way you will collect the data. So now you have to describe your variables. Which one is your dependent variable? Which one is your independent variable? How are you going to measure your dependent variable? How are you going to measure your independent variable? You have to state all these things here. For example, I say I want to find out the level of knowledge of tuberculosis. So my dependent variable is knowledge of TB. I will say the dependent variable in this research is the knowledge of tuberculosis. So how are you going to assess the knowledge? How are you going to measure the knowledge? You also need to state it here. So the knowledge of healthcare workers will be assessed using 14 questions. This question assesses the knowledge of this. Each question will be graded or will be given, will be graded into the correct response for each question will have 1 mark, while the wrong response will have 0 mark. All the scores of all the scores of all the questions will be summed up and and converted into proportions. This proportion will be categorized into 3: good, fair, and poor. Anybody that scores 70% and above will be categorized as having good knowledge, while those with 50 to 69 will be categorized into medium or medium knowledge. Yeah. Then those that score less than 50% will be categorized as having poor knowledge. So you see, that is what I will do. I have stated that the knowledge is the independent variable, and I have described how I want to measure the knowledge throughout. Everything that you will use in order to measure such variable, you have to mention. So you now go to the next. If you have 2 dependent variables, you describe all of them. Then you go to independent variables. You mention them, and you describe how you are going to measure all the independent variables. So this is the measurement of variable. Then the next thing is quality assurance procedure. How do you ensure quality of data collection of your data? How are you going to make sure that this data you are collecting is of good quality? You have to also describe that. So maybe that one you can say you have to make sure that the research assistant were trained by you. They were you have to use so method of data collection. You have to use sample size collection determination, the correct formula for calculating sample size. You have to use random allocation of study participant. You have to train all your workers you have to make sure that, so all these things that will make sure that this data will be collected in quality. So that is how where you describe it here. Then the next thing is your plan for data management. So this will be data entry and data cleaning. How do you do your data cleaning? How do you do your data entry? Are you using ODK to collect your data? Are you using hard copy questionnaire to collect your data? If you are using hard copy, how are you going to enter it into the SPSS statistical software? Then after entering the data into SPSS, you have to clean it. You have to make sure that it's clean, it's transformed, it's done this. Everything is all right before you start analysis. Then the next thing is data analysis and statistical tests to be used. So you see in data analysis here, the first thing you have to do a descriptive statistic. Descriptive statistic is just describing what you have gotten. I said this is assessment of this, assessment of that. That is descriptive statistic. The next thing is you have to state all the statistical tests that you are going to employ for each and every specific objectives that require statistical tests, that require hypothesis. So all the any objective that require hypothesis will need to have a particular statistical test in order to use for it to answer the research question that we have generated. So for example, we say we want to find out our whether there is family help is associated or is related with medication adherence. So here, which test are we going to use in order to test this? In order to find this, you have to state it in your statistical analysis. So you can say chi-square test will be used to identify the relationship between family help and medication adherence. So another one, you can say independent sample t-test will be used to identify the difference between ages of male and female. So test will be used. So each objective must have its own test, particular test that will be used to identify it. So that is for data analysis. The next thing is ethical considerations. You must have ethical consideration. Where have you gotten your ethical clearance from? Is it from the state government? Is it from the management of the hospital? Where? Then confidentiality, then informed consent. You have to all put them here. Then limitations of your study. So this, any study has its own limitation. You have to find out what are the limitations of this study and write it at the end of chapter 3. So that after chapter 3, the next thing in the proposal is work plan. You have to show your work plan. This section needs to include the time needed to complete the study and break up of the entire time period from the start of title conception up to the exam time. You have to write your work plan. So week kadha, maybe week 1, I'm going to conceive my research title. Week 1 to week 3 is the conception of the title. Week 4 to week 7 is the literature search. Week 5, everything you have to make a plan. So the work plan breakup of the time period for different steps are mentioned as follows. 1, preparation of the proposal. You have to put it there. Preparation of the questionnaire or checklist. Data collection and data analysis methods and times. Finalization of the report based on the reviewer's comments. You have to put all these ones into your plan. So this is the example of a work plan. You see in the year 2022, and these the activities or tasks that were addressed, that were conducted. Number 1, formulating research topics. So formulating research topic was done in what? January. Then in February, discussion of the topic with supervisor in February. Then literature search from January up to March. You see, literature search from January to March. Reading on research proposal writing in April. You have now read about writing research proposal for 1 month. Then now you start writing your research proposal. So proposal write-up from May to what? To June. Then proposal defense at the departmental level. From what? From, it was done in July. Then you obtain ethical clearance from the management, UDUTH management. This one was done in August. Up to the end, up to the last one you see, prepare for part 2 examination. So it started from what? From January up to December. So from the first day you start your preparation for exam. So all these ones are they are all in preparation of part 2 exam. So this is the example of your work plan. You should have a work plan that explains everything from all the tasks, all the activities that you have conducted from the topic formulation up to the preparation for examination. So thank you very much, and we entertain question now and comment. Thank you very much for listening.
Thank you so much, sir, for the elaborate lecture. We so much appreciate. May Allah reward you abundantly for the effort. Okay, we have some questions in the chat box.
You can start.
Chat box. Yeah, this one is saying, this is a thorough lecture on research. God bless you, Prof. This one is saying, please, in terms of arrangement in the literature review, when introducing the conceptual framework theory and empirical evidence, please clarify which one is which.
So, literature review, conceptual framework is part of literature review. It's part of literature review. So, but usually it comes at the end. The conceptual framework comes at the end of the literature review. That is what I cited the example. It is a diagrammatic presentation. It's just a diagrammatic presentation of what you are going to do, how your research will go through, what are the interconnections between the factors that you think can affect the outcome of that research. And at the end of the day, what will be the main outcome and the main output of that research. So that's all about the literature review, the conceptual framework. It is under literature review, but is done immediately after the literature review because it is in form of diagrammatic presentations. Thank you. The next question. Okay, Oscar Vetz. You can unmute and ask your question, please. Oscar. You are raising your hand. So, Dr. Mujtaba, anyone again? Please, I've seen some people are raising their hands. One should unmute himself. Ernest, please unmute yourself and ask a question. Ernest. Or are you not hearing me? Are you not hearing me? Please, someone should respond so that.
Vanessa, sorry, my network went off.
Okay.
Okay, sir, the next question, I present address. Hello, sir, can you hear me?
Yes, I can hear you.
Okay, sir. Hello, sir.
Yes, Dr. Mujtaba.
Okay, sir. Sir, this one is saying, good evening, sir. If a resident is doing residency at UDUTH but want to collect data from SOKOTO specialist, which hospital is responsible for giving out ethical clearance?
So this one, you need to get ethical clearance from both hospitals because you are from UDUTH and you are going for exam from UDUTH. So you need to obtain UDUTH ethical clearance. Then you have to obtain clearance from specialist hospital. And the specialist hospital also, it's not the specialist hospital that will give you the ethical clearance. It is the state government, SOKOTO State Ministry of Health. So the SOKOTO state government, it will give you the ethical clearance. Then you obtain permission from the specialist hospital when you go there. Thank you.
Okay, thank you so much, sir. Others are appreciation. This one is saying, thank you, sir, for the presentation and clarity, made the topic engaging and easy understanding. Thank you so much, sir. Awesome lecture. Thank you, Prof. So most are clarifications.
No, I'm not Prof.
People
Guys.
raising hands. Eh, sir?
No, those that are saying Prof, please, I'm not Prof.
Okay, Dr. Anas is raising his hand.
Okay.
But you are more than Prof, sir. Maybe they should bring more people like emeritus.
Dr. Anas, let him ask his question.
Dr. Anas, please. Okay, Dr. Bida. Please unmute and talk. Okay, Dr. Bida. Okay, they are not responding.
Okay.
Dr. Oscar. Okay, I think is from the setting. Likely they cannot talk.
Okay.
Dr. Bello, can they talk?
Yeah, maybe they have unmute everyone. They have mute everyone, maybe. So maybe if we can unmute, so that everyone can unmute himself.
Okay, Bida, can you type your message? Okay, she's saying we can't talk. Dr. Bello, can they talk? Okay, this one is saying the 5-6 please of literature review. She's asking of the 5-6 of literature review.
5-6 of literature review. No, I've not discussed the 5-6 of literature.
Okay, sir. Okay.
Just follow what we have discussed. That is the most important. If you are conducting literature review, the first thing you have to cite. When you cite, you compare, you contrast, you critique. That is it. You cite, this is the result I have gotten. Then compare with it, contrast it, critique it. That is the way you should conduct your literature review. And I have also told you the outline you're supposed to use, not the normal outline that we are using in. We are doing the overview in the name of literature review. So that's all. Just use this. It's very, very important, this arrangement, because most people are being failed because of the arrangement. They didn't do literature review and they say it's literature review. Unless if you are lucky, your examiners don't know how literature review is supposed to be done, then in that case you can pass.
Okay. Thank you so much, sir. The time is fast approaching.
Yes.
Before we close, I would like to call the president of the association, Dr. Bello Moritula Ibrahim, for a short closing remark. Dr. Moritula Bello Ibrahim, are you available? Okay. Likely is not close. Thank you so much, sir, for the elaborate lecture. We so much appreciate. A lot of appreciation messages are on the chat box. People show their appreciation and understanding of the lecture. We so much appreciate your efforts, and we thank you for accepting our invitations whenever we go to for that. May Allah reward you abundantly. I would like to also extend our appreciation to all the participants and to our host, Dr. Bello Abdulkadir Katago. Thank you so much. Thank you, everyone. Thank you, sir.
Yes, you are welcome, Dr. Mujtaba. And thank you, everyone, for the audience. So we call it a day till next week, inshallah.
Okay, thank you so much, sir. Thank you, everyone. So next week, we should be meeting for week 2. Thank you so much.
So this is your 5C: cite, compare, contrast, critique, and connect.
Okay, sir. Okay, the person asking of the 5Cs is Dr. Bida. Thank you so much, sir.
Yes.